Hello, this is Leanne Kaiser, and I'm going to discuss current events 3 for MHA 575. This is long-term care services. This presentation came from a document I saw from Boston CBS. I-Team Watertown Long-Term Care Facility investigated for possible abuse and neglect. That made me kind of go look at abuse and neglect in Illinois. So the article I'm actually discussing is an IDPH launching external investigation of its Nursing Home Oversight Bureau that was in the Southern. The original article was from Capital News, Illinois, and was done on August 21st and then updated on September 26th of 2020. So ultimately came from the Southern. And I found it very interesting. So we're going to talk about a little bit about long-term care services and what they are, and then we'll talk about abuse and neglect. So Americans are living longer than ever before. However, the human body or even the mind can often become compromised at some point in life and can lose its functional capacity due to an accident, disease, or just wear and tear over the years. When people face difficulties with personal care or are unable to live independently, they usually depend on others' help or must be placed in a facility. So I think we all have experienced this in our life, whether it was for those of us that are older, it's with a parent, or for those of you who are younger, it's a parent or a grandparent. I think this is something that everybody can relate to at some point in their life when somebody they have in their inner circle or their family gets older and starts to need additional help. So I thought this graphic was pretty interesting. Long-term care talks about all kinds of aspects of long-term care. Some things that are popping out in there is bathing and eating, walking. There's talking about hospice, disabilities, dressing, assisted livings, respite care, hygiene, all kinds of different aspects of long-term care. So it's estimated that 70% of people age 65 and older will need some type of long-term care needs during the rest of their lives. So I think that's pretty dramatic number. 70% of people are going to need some kind of assistance along the way. So the average length of stay of a long-term care is approximately 3 years. So if you look in the middle, that's that 70% chance of people turning 65 or older today need some type of long-term care. So if you look, I found this one very interesting, and maybe others will as well. 3.7 years is the average number of years a woman will need long-term care versus 2.2 years average number that men will need long-term care. And I think that's because typically women live longer than men, and I think that goes into the play that women will often take care of men in the home before they will place them in some type of long-term care facility. So, but if you see also, it says 20% of today's 65-year-olds will need long-term care more than 5 years. So obviously that average length of stay is 3 years, but if you see, some are going to need even more care, 5 years. So on average, these older adults will need assistance in their homes before they become actually get into a more aggressive care in a facility. So I think most all folks will end up doing some kind of in-home services before they're actually transitioned to a facility of some sort. So the most common type of long-term care is actually not even medical care. It's considered personal care. These are also called the activities of daily living, or ADLs. You often hear medical personnel talk about ADLs, and that's what they mean, activities of daily living. Those things include things like bathing, dressing, grooming, using the restroom, eating, or moving around. So, for example, meaning getting from a chair to the bed or bed to the chair. Long-term care can also include community services such as adult meals on wheels, adult care, daycare, and or transportation services. These services may be provided free or at a charge depending on your community. So, some of these services in these communities are free of charge. So they'll, Meals on Wheels, they'll bring them to their home, or they'll take them to the senior center for activities of community activities. So it just depends on the community itself. However, in their final years, they're more likely to spend in either a nursing home or an assisted living facility. So I think this is probably one of the most important things that we'll talk about today before we get into the abuse and neglect piece of it, is who pays for long-term care. I think there's a big misconception by a lot of folks in the country that Medicare will pay for long-term care services. That's not correct in most instances. So they do not pay for things like nursing home or assisted living facilities. Medicare will only cover a nursing home stay for a maximum of 100 days, and that's post-hospital recovery, also known as post-acute care. And they provide no coverage for custodial care, so no home situation. What happens is a patient had to have been in the hospital a minimum of 3 days for some kinds of situation, whether that be a fall, a surgical complication, an issue, maybe they're very, very sick and have a little bit of a, lung capacity issue, or they can't get up and down, then that Medicare will kick in and pay for up to 100 days of that post-acute or post-hospital care. But they don't pay for traditional long-term services. Neither does any traditional health insurance. So, for example, I myself have, I'm covered by HealthLink State of Illinois. Since I'm a State of Illinois employee, it would not provide any coverage for a long-term care facility. So, would not cover a nursing home or an acute care center unless it's related to some kind of post-acute care, the same as Medicare. So, however, we talk about no traditional healthcare covers long-term care. There can be what they call private long-term health care insurance that you can purchase. However, it is very costly. So in 2007, the average premium for long-term care was $2,207 a month. So that depends on your age when your coverage starts and what type of coverage that you're going to be asking for. So if the average care for somebody, so for example, let's just say somebody my age, middle 40s, starts trying to get long-term care insurance. Most people cannot afford to pay $2,000 to $2,500 per month for long-term care insurance above and beyond their other healthcare needs or their regular life needs. So, on top of your house payment, your car payment, your insurance coverage, to pay another $2,000 or $2,500 a month for possible long-term care is just something that's not in most people's budgets. That's what we would consider out of reach for most individuals. Medicaid covers the vast majority of nursing home services, but only after a person's assets have been depleted. So in other words, to get Medicaid to pay for long-term care, you would have to get rid of that individual's home. They would have to exhaust all of their retirement benefit money and any savings that the patient has. So if you have an individual who's owned a home their whole life, they've owned a car, they have a pretty healthy retirement, the only way that Medicaid is going to pay for long-term care services is once all that has been depleted. So in other words, when they will sell the home, they will take every bit of the retirement money or savings, and they will typically leave the patient very little per month out of any of those monies that has been either used or sold off for the patient, and that's considered for personal care items. And it's as little as $40 or $50 a month that they give the patient to spend on their own things. So in other words, their own shampoos, their own toiletry items. That's all they would get out of that, all that money that they've accrued over the years. That house, that car, the retirement, the savings, all those things will be depleted in order for Medicaid to cover it. So if you look at this actual diagram, Medicare pays for 10%. And again, that 10% that they're talking about is that post-hospitalization, post-acute care. Medicaid pays for 34%. So that's the largest, other than out-of-pocket. So other public entity funds, 1%, and out-of-pocket 52%, and private insurance 3%. So that private insurance is covering post-acute or post-hospitalization care. That out-of-pocket 52%, that would be some individual who's basically accrued enough in their retirement or their savings over the years to pay for long-term care services that they need. And long-term care services can be very expensive, upwards of $5,000 to $7,000 a month, depending on what type of facility you're in, depending on what kind of services you need. If you just need, light services, obviously the charges are less per month. But if you need full 100% nursing care, you're upwards of $6,000, $7,000, $8,000 a month in a facility. So that's why I think it's important to understand who pays for that long-term care, so that especially those of you that are young, that are just out of high school and out of undergrad and seeking your master's degree, you can understand that this is not something that Medicare is going to pay for you over the years. If Medicare is there for you when you are elderly, that you will need to provide those services on your own. So I thought this was a really cute graphic, and especially for those of you who are younger, you hear a lot about the baby boomer generation. So most people don't realize that 42% of the adult population in the United States is made up of baby boomers. I personally didn't even realize it was that large, and I've been obviously studying healthcare and been involved in healthcare 25 plus years. So that's just a huge number. And then if you look, there are 78 million people born from 1946 to 1964, which is the baby boomer population. So it's just huge, huge numbers that I think we weren't necessarily thinking about. So the older population's rapid growth is going to put a significant strain on long-term care industries, especially beginning in the year 2030, which, sounds like it's a long way away, but, we're only a little over 9 years from that, when the baby boomer generation reaches 85. So when the average baby boomer reaches 85, that would be the prime time that they're going to need long-term care services. So I think that's why you see this industry is really booming right now. Lots of long-term care facilities being built, whether that be, retirement communities, whether it be long-term care facilities. I think we're really planning for the fact that this is going to be a huge hit over the next 10 years or so. So with that rapid growth of long-term care usage from the baby boomers comes much more potential for elder abuse and neglect. And I think this is something, we all think about when you think about placing a loved one in a long-term care facility, whether that be in a nursing home or whether it be in a, acute care facility, or whether it be in a retirement village, all those different types of facilities. We run the risk of, how is somebody going to take care of your loved one? How's that going to go? And how are they going to be treated in that facility? So that's the concern, is elder abuse over time in these long-term care facilities. So when we talk about elder abuse includes physical abuse, emotional abuse, sexual abuse, exploitation, neglect, and abandonment. So it's not just the physical abuse aspect. That's somebody, verbally mistreating your loved one. Sexual abuse in these facilities is a lot larger than anybody realizes it is. Exploitation, and what I mean by exploitation, meaning, somebody's exploiting them for their money. If some of these older individuals, especially if they do have a lot of resources of their own, but maybe their mind is not what it used to be. Maybe they have some type of dementia or an Alzheimer component. That financial exploitation is also considered elder abuse. And then just neglect and abandonment. We find so often that these elderly people are left in their homes with very little contact from the outside world. No one's checking on them. Their family members aren't checking on them. So that literally they're just left 100% alone. Maybe they're not eating right. Maybe they're not taking care of their healthcare needs. Maybe they're not even able to ambulate themselves in their own home. So lots of different aspects of elder abuse. Perpetrators can include spouses, children, other family members, and staff at nursing homes or assisted living facilities. So, it's easy to think about it being the staff in a nursing home or an assisted living facility when that's not the case. It could be a spouse, a child, another family member who's supposedly taking care of them, is either, abusing them in some form or fashion, physical, emotional, or sexual. exploiting their money. Maybe they're writing checks to themselves when they shouldn't be, or maybe they're paying their own bills and leaving little to no money for the elderly person, or just neglect and abandonment. They just literally just leave them to fend for themselves. And so lots of different aspects involved in this elder abuse aspect. So when we talk about elder abuse, obviously, I thought this graphic spoke volumes. We need to stop elder abuse. So, by putting that on that stop sign meaning a lot. It says, according to the National Council on Aging, the NCOA, approximately 1 in 10 Americans age 60 and over have experienced some form of elder abuse. So that's huge. 1 in 10 Americans. I mean, just stop and think about that. So, there are a lot of us in this class. So, I mean, upwards of 4 or 5 people in this group knows somebody who has experienced elder abuse. That's horrible. And it's obviously something that we need to take a bigger look at and to get more involved in, especially as these baby boomers continue to age. That's going to put more and more stress on this aspect of care. And so therefore the concern is will it become even a bigger issue than it is right now? This is today's terms, and it's obviously when there's not been all the stress put on the system. So, are those numbers going to expand and grow? We can only hope they won't. So this article in the Southern talked about nursing home oversight. And so according to the article in the Southern Illinoisan, the Illinois Department of Public Health has initiated an external review of its Bureau of Long-Term Care due to delays in investigation of abuse and neglect complaints amid the COVID-19 pandemic. So the concern is during the COVID-19 pandemic, the numbers of abuse and neglect cases were not being reviewed appropriately according to IDPH's guidelines. And so they have asked for an external review of the Bureau of Long-Term Care that is kind of the oversight for the nursing home industry in the state of Illinois. So I found this very interesting that, due to the COVID-19 pandemic, we all know that during that pandemic, you could not go in and see your loved ones that were in these facilities. And so, if you were making a claim of abuse or neglect, you were doing that from an outside a window. You weren't in that facility during that time, and then only to find out that those cases were not being taken seriously and investigated in the appropriate time frame. So the article published by the Southern in September 2020 indicated that they had done the external review and kind of wanted to talk about what the Bureau of Long-Term Care duties, what they're supposed to be doing, and what their oversight is supposed to be doing. So this bureau, it conducts the certification surveys to make sure that a long-term care facility of any sort, whether that's a nursing home or any kind of unit, has to have an initial certification survey to prove that they are capable of taking care of the patients as instructed. So the assisted living facilities, the nursing homes, any of those types of care have to have a certification survey done. They also need an annual license inspection. So they get this initial very robust survey done to make sure they meet the criteria to become a long-term care facility, but they also get an annual inspection to ensure that they're doing what they need to according to the state of Illinois law. Then obviously the Bureau of Long-Term Care also does complaint investigations, and that's where this article had the concern, is the complaint investigations that weren't being done appropriately. Allegations were that the Bureau of Long-Term Care was not correctly processing and investigating complaints of abuse and neglect in long-term care facilities from March 15th through June 20th of 2020. During that period of time, there was 272 allegations of abuse and neglect that may have either been delayed or not reviewed appropriately at all. So these inspections were delayed even though IDPH guidelines state that severe cases must be surveyed within 24 hours, whereas less severe cases must be surveyed within 7 days. Per IDPH, when these issues were identified, surveyors were told to investigate all remaining abuse and neglect claims from that period of time immediately. So IDPH also claims that they took immediate action, including personnel action. So in other words, it sounds like they may have either hired additional personnel or they could have fired individuals that weren't appropriately doing it. to ensure completion. So once this was brought to IDPH's attention, they said that they immediately took action and dealt with all claims that had not been reviewed appropriately. So IDPH has also hired this Manat Health Strategies LLC to conduct a review of the Long-Term Care Bureau and give best practice recommendations. So that service is going to review how IDPH is conducting their business as a whole regarding the Bureau of Long-Term Care. So they're looking at their policies, their procedures, their best practices on how to move forward. But they've also hired Courtney Cox, which is the former U.S. attorney for the Southern District of Illinois, to review specific complaints. So they're asking her to take a look at specific cases, how they were dealt with, were they appropriately adjudicated related to these abuse and neglect claims, to see if it's something that they needed to further investigate, further review, or additional resources deemed appropriate for those cases. So my question is more oversight necessary? So allegations of abuse and neglect are serious and should be taken as such and evaluated appropriately as quickly as possible. So moving forward, there may need to be more oversight of these actions, both within the state of Illinois and at the federal level. So, the question is as these number of elderly grow and the need and the demand grows for long-term care services, are we going to need to look at the structure that's in place now to make it a robust situation? Do we need to expand both the state and federal guidelines related to long-term care services? Does there need to be more access? Do the cases need to be adjudicated more quickly, and how do we intend to deal with this scenario as a whole? So I think as we move forward, I think it's something we need to look at about the oversight of these situations and just how do we intend to handle this rapid growth and rapid need. So here's the resources I used for this presentation. And would be glad to discuss this situation with any of you. If you have any concerns, questions, please feel free to reach out to me. And if not, I will see you next time. Thank you.